This presentation is by Team Lemurs, and our global health problem is malaria and Cameroon.
Meet Joseph. He's a 5-year-old boy living in a small village in Cameroon. He's one of 3 children in his family, having 2 older brothers of 8 and 10. Just like everyone else in his village, he was born into a low-income family. This has caused him to suffer from food insecurity, as well as made him unable to receive chemo prevention, and they could not afford the new vaccine rollouts. A few weeks ago, Joseph began running a fever and was diagnosed with malaria. This has caused him to lay in bed all day, sick under his insecticide net. In a dire situation, as his family is unable to afford anything but the most rudimentary care.
Well, what is malaria, you might ask? Malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects a certain type of mosquito that then feeds on humans. Now, what it does, aka the pathology of it. When an infected mosquito bites a person, the parasite is transmitted into the bloodstream. Once inside the human body, these parasites travel to the liver, where they mature and reproduce. After a period of time, they re-enter the bloodstream and infect red blood cells, leading to the symptoms of malaria. The symptoms of malaria typically include fever, chills, headache, nausea, vomiting, muscle pain, and fatigue. If not treated promptly, malaria can cause severe complications such as anemia, respiratory distress, and organ failure, which can ultimately be life-threatening.
Now for the geographic significance. When it comes to disease prevalence, the presence of malaria in Cameroon is affected nearly 30% of the population, and this is due to geographic positioning and certain language barriers which create strife when it comes to trying to control the disease. Cameroon is a very tropical climate that hosts a large equatorial forest in its southern region. This means that there is a heavy rainfall and stagnant bodies of water. This causes mosquitoes to breed since it serves as a thriving environment for their larvae. The dense vegetation and low prevention measures contributes to a great widespread across the country. When it comes to cultural context, Cameroon faces large language barriers since French and English are both very prominent languages throughout the country. This creates a spread of misinformation about malaria prevention in rural areas. There is also a disconnect when it comes to traditional beliefs and practicing modern medicine. When it comes to concerns affecting the health system, there are 4 main topics. Political issues include inconsistent government funding for malaria programs, and then instability in certain regions which disrupts healthcare delivery. When it comes to economic concerns, high poverty rates limit affordability of prevention and treatment. There is also a loss in productivity due to a widespread disease burden. Environmental factors include poor waste management, which creates mosquito breeding grounds, and climate change, which may expand malaria-prone areas. There are even transportation challenges, which include poor infrastructure in rural areas, which makes accessing healthcare difficult, and seasonal floods, which further restrict the movement of health facilities. Now for the population overview and impacts. Cameroon is a very diverse population of around 28 million citizens. The main people prone to malaria are children, pregnant women, and rural areas. Malaria tends to impact the country socially by financial burdens that come from the treatment costs, which is around $10, which is actually a lot when you only have $100 to live off every month. And since pregnant women are more prone to malaria, it impacts infant mortality rates, which can only cause more stress among households. Individual impacts of malaria looks like missing day-to-day duties like school or work due to illnesses. And in very severe cases of malaria, it can lead to the patient having anemia, brain damage, and can even cause death.
There are some treatments for malaria, but the most effective treatment is prevention. Some preventionary actions include insecticide nets, which many people hang indoors over bed and across open windows to help catch and kill mosquitoes. In young children, chemoprevention is often the most recommended prevention. It comes in a tablet form and it kills the parasite before it can cause the illness. In 2021, there was the world's first malaria vaccine rollout within Cameroon, which brought down cases significantly as well. Avoiding mosquito bites altogether is the most effective form of prevention, but using other things like protective outer layers of clothing and bug repellent also help. Treatments for malaria are highly variable, as certain anti-malarial medications only work on certain species of the parasite. The most important part of malaria treatment is early diagnosis because it takes time to diagnose exactly which species you have and therefore what medication to take. There's also a higher chance of anti-malarial resistance as the parasite matures. $1 billion globally have been spent in the research and treatment of malaria. In 2023, around 3,382,676 cases of malaria were reported in Cameroon, with about a 75% success rate in treatment with anti-malarial drugs.
Population. Who is at risk? Genetic factors. When a genetic factor puts a person at risk of developing an illness, it means that there is a hereditary component to that illness. This can be due to specific genetic mutations or variations that increase a person's susceptibility to developing the illness. Environmental factors. When an environmental factor puts a person at risk of developing an illness, it means that exposure to certain substances, conditions, or situations in the environment can increase the likelihood of developing that illness.
This chart shows examples of how different complications and different scenarios can affect the impact of the disease.
Strategy. Action against hunger. Our strategy is to team up with Action Against Hunger and the Cameroon government. Action Against Hunger is an organization that aims to end world hunger. Our idea is when you show up to get the malaria vaccine, you get a free meal in exchange. Getting the malaria vaccine is a crucial part of ending the malaria pandemic in Cameroon, and offering a meal in exchange would make it more appealing and catch people's attention.
As a result of our strategy, our goal is to protect the lives and improve health outcomes by increasing malaria vaccination rates, particularly in vulnerable communities like Cameroon. By reducing the spread of this deadly disease, we can reduce suffering, strengthen healthcare, and boost economic development.